Okay, now let us look at another cardiovascular condition which affect the heart, and it is very common in sub-Saharan nations, which affect various valves of the heart. And this condition is called rheumatic fever and rheumatic heart disease. Rheumatic fever results to rheumatic heart disease, and you will see that how does this one progress. So, in rheumatic fever, the patient will have fever of more than 38 degrees Celsius. The patient will have some antibody antigen reactivations after infections on the throat by some bacteria, resulting to autoimmune, resulting to that the tissues of the body which has the same characteristics of the affected tonsils, the throat tissues also react the same, and this one results to joint pain, candiditis, nodules, erythema magnatum, and certain chorea types of syndrome, and you'll see them in the body. So in this case, the patient gets group A streptococcal throat infection, and these ones they attack the molecules on the throat. Then the mimic molecules in the body, they get affected, which are on the various parts of the body, like the joint, and then the patient has those conditions. Now, let us see at the pathophysiology is that you get group A streptococci, which infect the throat, resulting to inappropriate immune response by the tissues which have the same characteristics of the throat tissues, like the heart, specifically the heart valves, resulting to rheumatic heart disease. So there is recurrent infections. Then there is a cross-immune response by the host of the streptococcal antigen. There is abnormal reactions, autoimmune disease. Then the rheumatic pancreatitis resulting to all diseases of the heart, and then endocarditis of the valves, resulting to erosion of the valves reflex. So there is after this erosion, there is eating with fibrous tissues and deposition, and resulting to, when there is a result, fibrous tissue results to thickening. And when this thickening affect the integrity of the valves, resulting to stenosis and regurgitation. So the group A streptococcal pharyngeal infections presents clinically and manifestation of acute rheumatic fever by 2 to 6 days, but sometimes they can even take longer. So the body produces antibodies against streptococci, and these bodies cross-react in the body, producing similar antibodies, and then these result streptococcal component infection in the body, in the connective tissues, where they have the same characteristic, the one in the throat. So these ones result to autoimmune, especially in the like heart, joint, and the bone and the brain. So the affected areas, you can see the white drainage patches on the throat. So wherever somebody comes who is young, around 7 to 15 and Caesarean, those are the most common type of people affected by this one. You have to be very careful because it can be one of the cause of that problem. It can result to that problem. So any cardiac tissues may be affected. The valvular lesion most common is the mitral and the aortic valve. It's the most common, the mitral valve and the aortic valve. So sometimes it can have pericarditis or myocarditis. Rheumatic heart disease is the permanent heart valve damage resulting from one or more attacks of acute rheumatic fever. It is thought that 40-60% of the patients with the acute rheumatic fever will go to developing rheumatic heart disease. So some patient can go unsuspected for too long and resulting to debilitating heart failure. So rheumatic fever, rheumatic heart disease, a crippling disease. Epidemiologically, it is very common in the girls of 7 to 15 years of age. Very common in underdeveloped countries, and it is preventable. So the clinical features of rheumatic fever is that there is the major criteria, the minor criteria, and that the criteria calls John's criteria. So the major criteria is that migratory arthritis, which should be predominating involving the larger joint, candidiasis, and valvularitis, that is pancandidiasis, that's the whole heart muscles. The endothelium is affected. Sidham chorea, erythema magnatum, subcutaneous nodules. In the minor criteria, you have fever, arthralgia, elevated acute phase reactants, that is ESRS or CPR, prolonged PR view in the ECG. So the probability of acute rheumatic fever is higher in the setting of a group A streptococcal infection followed by 2 major manifestations or 1 major and 2 minor manifestations. So in this case, one should have 2 major or 1 major with 2 minor manifestations with a history of rheumatic fever. So you can see the person get that infection, then that is not infection, rheumatic fever, then